Hey guys, Dr. Grizz at 918 Chiropractic, and I want to tell you about why we are able to help with vertigo. If you don't know what vertigo is, that's that dizziness when you get up. That's that feeling like you've been on a boat for weeks at a time. That's that feeling like you had too much to drink, but you've only had water or coffee. That's a vertigo scenario, and there's lots of reasons that it can happen. Most of them being in the inner ear. However, chiropractic very effective for two types of scenarios with vertigo. And I want to tell you about them now. In the inner ear, if the atlas rotates, that's the first bone right here. It's got these little wings on it. These are the transverse processes. If it rotates one side or the other, this can put pressure or put tension on a muscle called the tensor valli palantini. It's Latin. I like to call it the TVP. TVP. When that rotates, it pulls on the bottom side of the eustachian canal and cause you to have blockage. This can stimulate you to have a little bit of vertigo or ringing in the ears. Another one that I see more often than that is actually from the second bone in the neck. That's C2. Just for demonstration purposes, I've unscrewed this model so that you can see it. This is C2, and C2 has a little thing that your head, it's called the odontoid process, it's not called a thing, that your head rotates on. It's called the odontoid process. It sticks up on the front side of your spinal cord. If C2, the second bone in your neck, goes down, it puts pressure on the front side of your spinal cord. And guess what's there? Your vestibular system. How do you know where you are in space? And so when people come to see us, very often, they won't even mention that they're having vertigo. I'll see on an x-ray, hey, they've got a lot of rotation at C2, or it's inferior or superior. What's going on there? The patient will always tell me they have some sort of dizziness. And I'm going to tell you right now, what ends up happening is because of the inferiority of C2 puts pressure on the front side of the spinal cord. What happens to sit on the front side of your brainstem and or spinal cord is the vestibular system. And we get great results with that. We have people drive other people, because if you have vertigo, you shouldn't be driving. Drive other people to our office from as far away as Fayetteville and Fort Smith just for this treatment, because we are so effective at it. If you're seeing this, hearing this, and you're a chiropractor, and you got vertigo patients and you're not doing great with them, check C2. See if it's up or down. That may stimulate what's causing the vertigo, and then you're the hero again. Dr. Grizz at 918 Chiropractic, I want you to know that your symptoms can be maintained, corrected, and taken care of by looking at a natural alternative to just taking a bunch of drugs for your vertigo. Maybe there's a mechanical problem. And if that's the issue, we're your guys. Take care.